Y quizás esto sea una pregunta como conclusión de la jornada, pero la hago al principio. ¿Usted es optimista o pesimista sobre cómo las redes sociales van a potenciar o no estos defectos, teniendo en cuenta además un factor clave, que es la ruptura de la intermediación clásica de los periodistas entre quien sabe y quien no sabe, en el caso de la salud, y claramente pues, los focos emisores de información, las que sean, se van a poder poner en contacto con el público, y el público, a través de las asociaciones de pacientes, hoy tendremos ejemplos, van a poder también presionar directamente sobre la propia origen de la información, creando al mismo tiempo información e intercambiando colaborativamente esta información. ¿Cuál es su opinión sobre esto?
I am generally more positive, more optimistic than I am pessimistic for some of the reasons that I talked about. That, for example, there are non-journalists who have much to contribute that I now follow every day on their blogs and on Twitter or on Facebook, because they now have been given this platform, this channel, this opportunity to communicate that wasn't there before. The key will be, my biggest caveat is, how will we help people evaluate the integrity of that source? And underlying all of this, and that was the theme of my talk, we must have a much smarter, a much more informed healthcare consumer population in order to be able to make those judgments. We think, I should say, that the 10 criteria on that mousepad that we apply to the review of every story, that those 10 criteria pertain not only to news stories, but actually could be a good basis upon which to evaluate any healthcare claim from any source, including perhaps your interaction with your physician. To ask your physician, give me numbers about how small or large are the potential benefits in my case. How small or large are the potential harms in my case? Help me understand, doctor, how strong is the evidence? How good are the studies that have been done? And on and on. But certainly what we hear from our hospitals, our medical centers, our drug companies, our device manufacturers, I believe these criteria could apply to the scrutiny of claims coming from any source, not just from news sources.
¿Se anima alguien ahora que se ha roto el hielo? Gracias.
José Valverde. Yo soy médico. Quería hacer una pregunta, mejor dos. Una es, en el mundo médico ha aparecido una nueva figura, que es el paciente que sabe más de la enfermedad que el propio médico y que en Estados Unidos está descrito como el apomediador. Y se le tiene cierto respeto. Desde los medios periodísticos se les tiene el mismo respeto a que ocupen ese lecho que existe, ¿no?, de mediador de la información. Y por otro lado, la medicina basada en la evidencia, los informes de evaluación de tecnologías sanitarias, tienen décadas. ¿Por qué es tan poco sexy para los periodistas comentar sobre los informes de medicina basada en la evidencia, sobre los informes de evaluación de tecnologías?
Let me make sure that I understand. Are you asking why aren't stories questioning evidence?
No, why journalists don't use stories about evidence-based medicine?
Well, I do think, and I should have said this in my comments, that I do think that at least in the U.S., which I know the best, there is tremendous improvement in that area. I'm not satisfied yet. I'm impatient, but I think that in the U.S., this organization that I'm part of, the Association of Healthcare Journalists, which has about 1,000 members internationally, most of them in the U.S., has been a leader in all of journalism, of all the fields of journalism, business journalism, economic journalism, political journalism. I think that that organization has helped promote quality improvement and on-the-job training more than any other subgroup within journalism. And these very topics that I talked about and that you asked me about, people are finding more ways to tell these stories. But I don't know. I can't answer your question. If what makes a good news story is something that affects your health, something that affects your pocketbook, your wallet, something that is controversial, something that affects businesses, something that affects national economies, and something that questions the conventional wisdom, I would think that would be a leading news story. But it is still a difficult sales job in many newsrooms. We're making small, slow, incremental progress. But there's a lot of cultural change within the population, but also within our newsrooms that needs to take place to accept these ideas.
And what about patients that know more or less, than doctors?
Oh, yes. Well, I'm very sensitive to what that, to the dilemma that can create for physicians, but I think that it is something that medicine is going to have to learn to deal with. That indeed, if we have seen, as I think evidence has shown, that patients who are better informed make better decisions with their physicians, in partnership with their physicians, if the better informed patient makes better decisions and has better outcomes, then that is an ideal that we should pursue, and that some of the pains and struggles along the way that might affect physicians is something, it's a growing pain that we will have to deal with. I'd be interested in hearing your thoughts about that, if not now, then later.